start.
Hello, this is Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York. Today with the treatment for a headache case. My brother today came in. You don't mind me filming my brother, yes?
No.
You came today with a headache, yes?
Yes.
Yeah, the first visit for the headache now for this episode, yes?
Yes.
Okay. How is the headache now?
It's much better.
Much better. Okay, guys, when I tried to examine my brother today, first for the vault hole, what I do here, the left side was pumping the cerebrospinal fluid. The cranial rhythm was much pumping here, but nothing here. I'm gonna tell you guys how we can fix that. But I was doing evaluation first. So I evaluated the vault hole and the pumping was only on left. Then I tried to examine the temporal bone doing this movement here. One finger inside the ear, the ring finger in the mastoid, the index finger in the pterygoid process of the temporal bone. And you can ask a patient to have a long deep breath, breathe in, my brother, to see what the effect of the primary respiratory mechanism in temporal bone. Now it's better. Before was this one was moving, the left ear was not moving at all. Then I did the sphenoid. How you examine the sphenoid? You're going to use two fingers for a sphenoid. With the sphenoid wing. Going to use the little finger, just an occiput medial to the occipitomastoid suture, and the index finger is in the greater sphenoid wing, like this and this. Ask you to breathe, brother. MashaAllah, MashaAllah, God bless, congratulations. Now it's moving perfect like that. Now, before you couldn't believe it, was moving like this, rotational, was moving only rotational to the left. How we fixed the greater sphenoid wing? As soon as I did the sphenoid, it was rotational, like this, it was rotating like this. Then I examined the occiput, because this is a sphenoid, matches with the occiput. Occiput is here, the sphenoid is here, they go together, meet at the sphenobasilar joint in the bump. Okay guys, and they move like this. Okay, when I examined the occiput was moving only the right side, left was not moving at all. Ask them to take a deep breath, pour out. Wonderful now, it's perfect now. But before, when you put your hands on the occiput like this, these two fingers pointing to the transverse process of the C2. This right side was moving in occiput, left was not. So then what I did, guys, for this. Okay, let me tell you about the bolt hold. The bolt hold, most of the cases, most likely the ethmoid suture could be tight here, and he was having a noise, noisy breathing. The nose was blocked. So I released the ethmoid suture this way. I cup his nose like this, and two fingers, I took the frontal bone up and pull the nasal bone down tiny bit. With very light pressure, sustain it for 20 seconds or so. This will release the ethmoid suture. This much better. How I released the sphenoid here? I asked him, my brother, get your big thumb. He gave me the thumb here, put in his mouth, on the top of his mouth, in the right side, because this side was stuck. His sphenoid was moving this way, rotationally. Left moves, right does not move. Put his thumb in the top of his mouth on the right side and asked him only 5 grams of force. Push up, and I monitor here for maximum 15 seconds, 11 seconds. Keep pushing, my brother. He kept pushing. Now relax, my brother. Now, as soon as he pushes, this moves. I monitor. The sphenoid is this greater sphenoid wing is one bone. It was first rotational like this. As soon as he moved the hard palate moved the vomer, then you're moving the sphenoid this way. So you fix the sphenoid. Then the sphenoid was not fixed 100%. So I fixed the sphenoid. I came to the sphenobasilar joint, and this actually my technique. This Dr. Salem technique for me. I hold the occiput with the lower hand, and I hold the sphenoid with this hand, and I start mobilizing with less than 5 grams of force. Mobilize the sphenoid this way, guys. Very gentle. Now mobilizing the sphenobasilar joint. As soon as I did this mobilization, the sphenoid was moving perfect parallel. This occiput was moving very well, and the full tooth was perfect, and the temporal was amazing, and headache is gone. Okay, this is a way, this is a case live from my clinic today with no preparation, just came with a headache, not pressed. So I just like to work. not for filming, but we just got the opportunity. So many people can learn. Please, so many people and young doctors need this video, so please share it as much as you can. And if you have any questions in the comments, leave it below. Again, this is Dr. Salem. Bye now.